been training clinicians to do additive prosthodontics. I've been working with them and they present to me several cases where they found that they need more training. When we analyzed together the case, I realized that many times the diagnosis is not correct, like also the data collection, and of course the treatment plan cannot be any better. It's difficult. It's difficult because we think nowadays that, for instance, technology can help us, but can they? Really, lab technician provide us teeth that fit the patient like and even better the original, and everybody live happily ever after? Let me give you an example of what not to do and a trick, a semiotic trick to improve your diagnosis. Let's talk about the hottest topic, anti-aging. Nobody wants to age, and so the teeth, the mouth, is part of this project. And many people with a broken incisal edge are receiving beautiful reconstruction. Unfortunately, many of them are just reconstruction. What I mean is that the dentist is just doing a sixth repair in a different way. Veneer, direct composite, doesn't matter, crowns. The problem is that this repair is not many times integrated in the function of the patient. What I mean is maybe the repair will not last longer. And so from an initial patient extremely happy, we have a problem because the same force that have damaged the enamel, they will attack the repair. And now we have a patient that is not happy, and he lost also trust in us. So we need to prevent this from happening, and it's hard. I know, I feel your pain. So let me help you with the bad news first. The bad news is that you cannot see how a mouth is moving on the articulator. Stop this madness. And even in the mouth, don't expect the patient just do tap tap and slide on one side and slide on the other side, and you are check all their function. The real function is called mastication, and that's why I developed this simple but extremely sophisticated test that is called the G-test, where the patient will chew a gum with us, in front of us, and we will get information. So let me talk about the anterior garage. Here we have a car, so the mandibular anterior teeth, and a door of the garage. How the car is parked in the garage while you chew in a different way. Every patient is different, but we need to see if in some patient where the incisal edge is fracturing, if is the car that is hitting the garage door. Because if this is the case and we repair, making the door longer and thicker, even though it's beautifully bonded, this door will lock the car and the functional conflict will be even worsening. So how can we explain to us and to the patient with a simple 3-step semiotic trick? Take the lateral, because it's the tooth where the majority of the functional conflict related to a mastication that is more horizontal happen. So take the lateral and just lengthening the incisal edge with a little flowable composite, not etching the tooth but just polymerize. At this point, you provide a gum to the patient, but you ask the patient to chew on the contralateral side, and you start to look what happened to the car when it starts to face the presence of the composite. And what you see is that the patient starts to say, hey, but I don't like it, it's uncomfortable. You say, okay, go, remove this. Say, I don't like it, okay, keep chewing, oops. And the Ferbocomposite is the touch. And this is the best way to demonstrate to the patient that 6 teeth restoration is not a good idea. And if the patient insists on having this type of reduced treatment, not facing a more global rehabilitation, send the patient away. Because another dentist that doesn't know the existence of this G-test will do the 6 teeth. They will fracture and that patient will come back to us. So get this trick, use it, and get in touch with function, because nobody just do aesthetic. You touch the tooth, you touch the body.